Oh, hi everybody. My apologies. Nice to be with you all. I hope if you're looking for House Party, you've got the wrong feed. This is JDRF. Just by way of introduction, I'm a pediatric endocrinologist at the Hospital for Sick Children. I'm privileged to be engaged in the care of many families and individuals with type 1 diabetes. And JDRF has kindly sort of asked me to come here today and speak with the sort of online community as well. So I did want to sort of perhaps just start and allow people to join in as we sort of are just sort of initiating this conversation, and perhaps address some key issues that we are hearing a lot clinically, in regards to youth with type 1 diabetes, and now, the current situation that we are in with COVID-19. And I think there's some key messages that if we could sort of share, and if they're repetitive for individuals, I apologize. But perhaps the number one question we get asked is regarding risk, and sort of the idea being that, and I think it's important to stress, is that individuals with type 1 diabetes are not at an inherent higher risk of catching COVID-19 or other sort of viral infections. And that comes with an understanding that if individuals with diabetes, if they would be unfortunately, if they were to get a viral infection, there are additional implications that do require some elements for proper management, and we can touch base on that as well. So trying to, I think, avoid sort of interacting, and this is why many of us are physically isolated, working from home, and if we're not in the essential services area, such as working in retail, certain retail environments, or healthcare, or even banking, or other things where we have to work, that would be sort of the ideal situation. But even if we are in areas where we are working, I think there's other ways that we can try to protect ourselves and protect our family. The other question we get asked a lot is, are we seeing this? Is this a common occurrence in young people? And I think the message about people, individuals, in children, adolescents, we are not seeing sort of this to be a common occurrence. When initially I spoke to some colleagues who were in China, and in addition to Italy and other parts of Europe, and they had shared that they had not seen type 1 rates along with COVID, but they are seeing a few. Most recently, there was I think there was a 14-year-old patient that was shared with me, and certainly what was shared was this was an instance where there was I think a parent who was a healthcare worker, a frontline healthcare worker, and then the young 14-year-old patient with type 1 diabetes also, unfortunately, sort of did catch COVID. She had mild illness. It was about 4 days of some, classic features of some cough, some fever, other sort of flu-like illness, and it did resolve after appropriate management. She did not have to be in the hospital, and she was able to manage this at home. So these are sort of, I think, experiences that are helpful to us in order to know how to prepare and how to be prepared. And I think it's that preparation, and it's that balance between being reasonable, not being fearful, being patient and not panicking. And I think filling, our this uncertainty with sort of education and knowledge as much as we can. And I think those are also key messages. An additional key message is that, as healthcare professionals, be it diabetes educators or dietitians or physicians, nurses, individuals like myself who are privileged to sort of care for individuals with type 1 diabetes, is, we have not disappeared. We may have different ways of communicating with, our patients and our families, but we are here. We are trying to sort of go through an element of protection in trying to limit some of the direct face-to-face interactions, but we can still communicate via virtual means. And I think our clinic at the Hospital for Sick Children, like many clinics throughout Ontario, Canada, and the world, have sort of very much adopted to this virtual model. And I think it's really important that we sort of allow that. A concern that we do have is, are people waiting too long even? Is fear of coming to the hospital, is that going to lead to further complications? And that is a fear that I think at our hospital we are worried about. I'm on hospital service right now, and we, interestingly, we did have a new onset patient come through this week, and they perhaps could have come earlier, and I think the family recognized that there was a hesitation related to coming to hospital, and thankfully this young man is doing very well, and the family are sort of going through that early phase that so many of the people I think on the call have lived experience with. But that those are, I think, things that we have to be mindful of. If you don't need to come to hospital, well and good. But if you are unwell and if there's concerns, then certainly either reach out to your medical team. Be prepared in terms of having the knowledge about managing illness with type 1 diabetes, and know that we are certainly here to assist you. So I don't want to sort of take all the time, but there are some questions. Rosalie has asked about teenagers with part-time jobs and type 1 diabetes. Should they still be going to work? I think there's teenagers I would suspect most teenagers perhaps don't have essential roles. However, perhaps that's a wrong assumption on my part. If it is important, perhaps helping in a family business, perhaps it's sort of assisting, in another capacity. I think the same rules about, how do we be careful, and the same things we've been hearing, so much in the media and the lay piece about, what to do before, what to do during work, and what to do after work are really key. Frequent hand washing. Look, when we walk into our hospital environment, we're not wearing jewelry, we're not wearing rings, we have proper hand hygiene, we don't bring anything that we don't need. If we have a lunch, it's in a disposable container. While we're at work, we're very careful about frequent hand washing, disinfecting, and again, if we're interacting with patients, we are able to wear appropriate masks, and I think that may be a reasonable thing to do if you need to work. But I don't think a blanket yes or no, if it can be avoided, that would be preferable. But if it can't be avoided, then taking those precautions is worthwhile. Okay, I'm just going to scroll down. Yes, and so I think a question is asking about returning to school from Lauren. And Lauren, this is, again, we are being asked this frequently. We were being asked before. We had some patients who were, in the area whereby the quarantine was for Ontario around the military base. Is it safe? And again, I think it's important to stress that if in patients who do not have complications, who have sort of good control, type 1 diabetes, they are not sort of having immune compromise. And we normally don't treat our patients like this. There are indeed consequences of becoming sick and unwell that we sort of it's important to know in terms of management. But I think we have to, trust that the school system will have appropriate, sanitizers, hand washing. They're going to have to change the classroom structure. It was actually introduced, I think, in Denmark and in Belgium today, where kids went back to school. And things were different. There's going to be that element where we are going to go over this complete shutdown and lockdown. And I think we mentally have to be sort of ready for that, be it temperature checks, be it sort of how we sort of think about our days and how we sort of manage this. COVID, in the absence of a vaccine, COVID is not going away. And we're going to have to live with it and try to balance it into our lives. So your concern, is reasonable. That's our job as parents, is to be worried about all of this. But at the same time, we have to balance the advantages of a I think there are advantages. My kids, I'm sure like many people on the call, are going through e-learning, and there's great potential benefits for it, but I don't think it replaces face-to-face instruction and the socialization. So I think we have to be ready for that, and we have to be sort of open to sort of sharing our concerns with educators, understanding sort of how that would work and with our young people. So that would be, I think, a reasonable, I hope, and balanced approach to this. But the caveat of all of this is we are learning. We're learning in real time. And so, looking ahead to the European experience, to the Chinese experience, to other countries, to see what worked and what didn't work. And hopefully by us waiting a little bit longer, we're going to have the advantage of that. Anyway, I hope that answers your question. A shout out to Jaya. How are you? And in terms of blood work, right now, if I can share from a hospital perspective, so blood work can be done certainly in hospitals if your regular clinic it's part of a hospital, or it may be done at an outside sort of lab. Most of these sort of areas have instituted significant precautions. Where I work, we go through quite there's a screening process. People with fever, people with symptoms are not have to sort of are sort of managed differently, because we have to sort of make sure that our institution and labs and other places are, as much as we can, safe, and we know that there are people who are truly immunocompromised as part of that. So I don't think I wouldn't. I think with precautions, so hand washing. I think the idea of masking. We've had Dr. Tam and people have gone back and forth in that. But when we see patients, we wear masks. And I think when you're in an inside environment, I think that's reasonable to do now. I think when you're outside, I don't think you need it. But if you need blood work, that can be helpful. Now the question is, what blood work do you need? Do we need to be assessing an A1C? For many patients who are on continuous glucose monitoring, we can look at other measures which I think are equally as valuable. Looking at time and range. And we've been able to do a lot of virtual visits by assessing continuous glucose monitoring data, which will give us blood sugars every 5 or 15 minutes based on the technology that's being used. And looking at time and range with an estimate of A1C, I think is very powerful. We are now targeting greater than 70% based on some other criteria for most of our young people with type 1 diabetes. And we were able to view that by having you upload into respective programs, be it Clarity or Diasend or other programs, and I think we're able to look for it. So do you need to come in just for an A1C, and can we do a virtual visit without it? I think if there's CGM, or we can look at records, if people are also on multiple daily injections, I'm not sure we need that automatically. So I'm not sure that we would do that. If there's other medical concerns, such as monitoring for, say, thyroid or other chronic diseases, that's a different question. But I wouldn't say that you need to come in instantly for an A1C, and we can perhaps look at some other data. I think Francis, I think I did sort of, address this earlier, with regards to, the school question. This is an area that is of significant concern, and we're going to have to get used to it again. So how do we empower ourselves? How do we empower our kids? I think we have to, again, go through sort of, I think we have to, it has to be fear, not fear, but it has to be reason. And again, how do we empower them? It's with hand washing. Fears of getting sick or unwell. I think we have to recognize is that if, and then look, if you get sick and you're of the age of the patients we're dealing with, this is mild illness. It's like the flu. And certainly, I think social media and other places will, share with us the worst of the worst cases, and perhaps that's what we all remember. But the vast majority of young people who, even if they are positive for COVID, recover and remain relatively healthy. This is a condition, and we're dealing with a tragedy that's going on in our long-term health, homes with their elderly. And unfortunately, this is a condition that has a huge proportional impact for older people. So I think, we have to understand that you're going to know people who get sick. We may get sick, I may get sick, and that fear of getting sick being a failure in some way, we also, I think, have to perhaps, move from that to say that, nobody wants to get sick. We're going to do everything in our power to be safe and hand wash. And if we need to sort of look at those precautions, because, it's preferable. It's just like the flu. With knowing that we do have a little bit to learn from there. So I'm not here to be oversimplify, and I'm not here to sort of make this sound sort of less concerning than it is. But I think we also have to keep in mind some of the context and work with some of these issues. I hope that helps. The question from Eric is it true that high blood sugars decrease your immune system? I think we're looking at a lot of the information that's coming is coming from the adult literature that's been quite fearful for many of us to hear about, older individuals having these risk factors, and they keep mentioning diabetes. That again is type 2 diabetes, and often those are people, those are sort of elderly or mature individuals who, in addition to diabetes, may have cardiovascular or other cardiorenal complications, and that does, I think, is an important factor. I think if you're having sort of, type 1 diabetes that is managed appropriately, and, there's variability in type 1 diabetes. I think all of us are aware of that. We have highs and lows. No one has, perfect blood sugar of 5 millimoles per liter throughout the day. And that variability is also normal. So in that context, that no, we would not be seeing significant alterations to the immune system that would make you or your child immune compromised, and that's not how we regularly treat youth with type 1 diabetes. I think we sort of address sort of some of the school issues, and then a common question again. I think Troy is inquiring about insulin availability. We have to, this is a myth that I think also has to be sort of addressed. There, is not an insulin availability issue. All of the major manufacturers of insulin, that are used, be it Novo Nordisk, Lilly, or, they've all said that there is no insulin supply problem. So I think we should be reassured by that the pharmaceutical companies have been very clear on that. Where we're running into it clinically is there may be the odd pharmacy that perhaps has, it doesn't have some, and then that leads to, a little bit of a cycle where we as patients and prescribers and practitioners, start worrying that, perhaps there's a supply problem, but there's not. Those supplies are being rectified. And it's also because, many people, when they hear, you need to prepare, I think some people, and this is very much human nature, would want to perhaps have more than they would normally take. In those instances, that's been the primary cause of some pharmacies not having adequate supplies. The Canadian Pharmacists Association has addressed that by having, a 1-month supply for all of the medications, so that we can ensure that there is enough for everybody. It's kind of the toilet paper problem that, if we can sort of make sure that, we are all covered, and then our neighbors and members of our community are also covered too. So I think that has helped, and we're not having that same issue since they put in that idea of having, insulin for a 1-month supply. In terms of sort of lockdown and travel restrictions, I would hope, Troy, that you're able to access insulin from a local pharmacy, and that you are not being hampered in that availability to it. Kimberly's asking a great question about healthcare professionals and healthcare workers. As a registered nurse who is sort of working on the front lines, in a COVID unit, and she's asking, should I, she's moved out of the home to avoid exposing her daughter with type 1, and this is that's a hard question, right? I'm in hospital. I'm sort of, seeing this as well, and it's a concern for many of us who are involved in healthcare. It's all, what is our hospital saying is, they want us to be safe. They kind of have thought of, the same things I'm sure you're thinking about already, which is related to sort of what do you do before work, what do you do during work, and what do you do after work. I think if you're able to sort of, again, not have jewelry, or if you're able to, do really, important hand hygiene, have the clothes that you can launder or your scrubs, not bring in anything else that, you can't dispose of during your work, while at work, going through all those adequate precautions that you're speaking of. And then after work is that, you separate out those clothes, you leave your shoes out, you disinfect your phone. Many people are showering when they come home, and they're not bringing things that are reusable. And then, you're sort of making sure, I think that would be adequate rather than having you move out of the home and the effects on your family. So I would temper that to say that this is what we're seeing. My colleagues who are experts in infectious disease have not moved out of their homes. They're still with their families. They're just taking precautions. And these are people who, are, akin to yourself, who are frontline, gowning and gloving and dealing with this, with every potential consult in the hospital. But they're at home. Christy, I think, is asking, in relation to recommendations for adults. The recommendations for adults are similar. I mean, Christy, you share that you're 36 years old. Just because you are still also, I think, at low risk. You do not have an increased risk because of type 1 diabetes of getting COVID. There's wonderful sort of the JDRF sort of updates regarding COVID have been extensively shared with adult endocrinologists and other health professionals. Those are really useful. I really sort of, I have to sort of, hats off to the JDRF for taking a leadership role during this time. Please, the idea of, you are, you're worried. And you mentioned that you had H1N1, and that was again a virus that sort of was very concerning for many of us. But again, this is we hope that as we learn more about this, we will just put in the same precautions related to that. So please don't freak out. The idea again is that let's sort of deal with this uncertainty. And let's educate ourselves in order to do that. And let's not panic. Let's be patient. Yes, and there's a wonderful video by Remy Lorette from Montreal, which is magnificent. So please watch that. Any suggestions? Rose is asking about to lower anxiety and worry and stress. You talked about diet, exercise. It's funny, we have, within our team, we have a mental health professional, we have a psychologist, and she always speaks to us of self-compassion and self-forgiveness. And, perhaps, these are abstract things that we think about, but, for any parent, I think we have to recognize, we see this in our kids. Kids sometimes have good days and they have bad days. We have the same. We are struggling with everybody being under one roof. When we call our families, this is what we hear a lot of: is how do we balance, the food and the activity and the blood sugars, knowing that there's not that regular soccer or hockey practice, that we know that there's sort of imbalance related often to food intake, and this idea of having a schedule, having some regularity is important. It's also important to sometimes break that regularity and be spontaneous and look after ourselves. And just understand that, we are been thrown into a situation which is, it's not perfect. Nobody really planned for this. Perhaps Jeff Bezos from Amazon, but that's a very bad joke. And so, can we also have compassion towards ourselves to sort of understand that we are making decisions in real time. And we're doing the best job that we can to make those decisions. And that I think, the exercise and activity and, having times to be, as, a bit of alone time, that is sort of allows you to sort of hear your own thoughts is very important because, with all of these stresses, we have to be careful not to be overly reactive, I should say. How do we sort of be nurturing to our kids who are going through a lot of this? How do we temper what we're hearing? 24/7 news cycles that are giving us a lot of valuable information, but many of us are just sort of trying to look at things at the beginning of the day and at the end of the day, and trying to sort of get on with doing things in between. And there's also this financial layer of, many people in the hospitality industry, again, there's a lot of people who are hurting. So how do we sort of help ourselves? And perhaps that gives us the better capacity to help others. So, these are words that we sort of try to live with, but, we have to also forgive ourselves from time to time. And so Catherine is asking, are complications more likely with individuals with type 1 diabetes once they contract the virus? No, they're not. Complications, again, are, we want to balance how well we're managing, with in terms of blood sugars, and we're not sort of, that's not an outcome that we're seeing. It's not affecting end organs like the kidney or the eye or other things. So it's akin to, again, if this is, akin to other respiratory viruses, we are not seeing that as a significant outcome. So thankfully, that's good to hear. And I think the experience from Europe and China also has to be very much shared. That they have some good outcomes coming through a lot of the significant hardship. And thankfully, look, our hospitals are not jam-packed. I can perhaps speak to my institution, but we're coping. And in many ways, we are seeing, because some surgeries have been canceled and other elective things have been canceled, that we're not seeing sort of jammed wards and the like. We continue to try to care after our patients who are, having complex medical needs, and trying our best to sort of do that. I think to a high standard. Perhaps that the worry in healthcare is that it's gonna get worse, and so we are ready for it. And I hope it doesn't happen, but we're trying our best to prepare for it. Okay, I don't see any other comments. I think one of the sort of the things that we've also heard about is concern about, if parents become ill or unwell, and their ability to care for their child, and sometimes that network of, say, grandparents or other perhaps older individuals that many of us rely on, you're not able to access that regular network for fear of older individuals who may be more prone to significant illness, not being exposed to COVID. And how can you prepare for that? How can you be ready for it? So I think the first thing is that these are all sort of the probability of that is not, it's unlikely, but if we're running into that situation and it's a younger child who can't care for themselves, and certainly I think the idea is you have to communicate with your medical team, you have to seek medical attention, and it may require hospitalization, and if that's the case, I mean, certainly hospitals, we're trying to sort of, again, be responsible and not limit spread, but we have many ways of communicating, and we expanded upon that a little bit earlier in terms of virtual care, and we also have the ability to we are not a testing center at our institution, but we do have the ability to assess patients if they do have COVID. And if that's the case, I think that's where we would work together and continue to provide family-centered care in whichever way we can do that. All right. Now we're talking about Marie Noel is asking in regards to in terms of trying to sort of manage her trying to manage the blood sugars. And I think sort of Rose is, of course, appropriately saying, well, her routine is off. So, I mean, that's likely to impact that. This is what we're hearing a lot of as well when we connect with our patients is, the fact that we're off of routines. There's next to the toilet paper are often bags of Doritos and other sort of goodies. And so we're all trying to sort of live as well as we can during this time. So that's so. How do we adjust? I think the same rules are what you're looking at, is looking for patterns. We are seeing increases in basal and bolus insulin that may be required. We may have to adjust insulin to carb ratios related to that if we're looking at sensitivities. And I think this is where please use your existing skills that you have. And certainly do work through that, but also connect with your team as needed. We are certainly here for helping to work with our patients and our families. I've actually heard the opposite, and where I've seen that some of some patients for whom managing diabetes within the school was fraught with a lot of variability. Well, we're seeing a lot better control now. So, and a lot of that is trying as much as you can to get that structure. It's teenagers. They tend to want to stay up late and wake up late. And sure, sometimes I think on a weekend, and that's often very reasonable. But how do we also sort of start to think about? Somebody asked earlier about schools reopening. This idea of trying to get back to a regular schedule, I think, is very important, and that certainly lends itself positively to diabetes management and how we want to optimize that. So what I share with a lot of my patients is I think this is opportunity, and the opportunity is that we can try to optimize as much as we can. But we're not going to go crazy to say that we're going to have perfect blood sugars, but it may be an opportunity to, for some of our patients, we've made changes in their insulin regime. We've added in some perhaps longer acting analogs. We've sort of been able to sort of make some, use some advanced pump features, and it does allow, because, many of us are at home together for the first time for an extended period, and it's a good time perhaps to sort of, indulge in, some further advanced diabetes management. Okay. Okay. If a vaccine, sorry, Judy, I think asked about sort of being mindful of adequate eating. I think mindful eating, Judy, bang on. I mean, eating in front of a screen is perhaps the hardest thing about sort of regulating, what you're actually eating. And as much as we can, sort of trying to eat together is always sort of very helpful, especially at least once a day. Vaccine related from Catherine, with the T1 patients with type 1 diabetes be the first to be vaccinated. It's an interesting question. In vaccine trials, they often sort of will look for individuals who may not have potential comorbidities. Because they don't want to see, they're not looking for the potential complications. So I would not suspect that individuals with type 1 diabetes would be the first to be vaccinated, despite potential risks, not of getting COVID, but of sort of some of the potential complications in management. And so, we are looking forward to the time for the vaccine. I think it's going to make things a lot easier, but the trials, I suspect, will be done first in adults. And then the results, perhaps, and then maybe we'll get children at the same time. I shouldn't be so looking at that, because I think it's important to do that. But certainly older adults would be the highest risk group potentially for adult trials. I think Yelena is asking about trying to sort of work through some trying to reduce A1Cs. No, an A1C around 8 does not put them at higher risk for complications. Continue to work on, all efforts to sort of, in a constructive way to see about how you can optimize glycemic control. I think would be worthwhile, but no, that is not out of control diabetes. Often what we see in young people is that, we do see, that the targets sometimes can be, some of the individuals may run us slightly higher than target, and we would work together in terms of trying to reduce that appropriately. So Daniel's asking, your wife is immunosuppressed and my son has type 1 diabetes. In terms of, so your son does not have higher risk of contracting COVID. So that's important to share. If your wife is immunosuppressed, then, certainly I think those appropriate precautions, I'm sure you have heightened vigilance for that. And, you are physically isolating and trying to care for her and trying to make all those, trying to avoid all those things as appropriately. It must not be an easy time. Okay. Good. So I think we are we're a little bit half past 7, and I think these sort of were intended to sort of run for about half an hour, and I would sort of request from you if I may sort of wrap up. Please feel free to sort of answer if there's further questions. If want to be posted, I can certainly work with the folks at JDRF in terms of helping to answer that. But I do appreciate everybody's kind attention, and please, let's, we are certainly, I think, we're learning lots, and I think this is a time for us to look after each other and know that, as your care teams, we certainly are here to do this. Okay, great. Thank you, everybody.